Good evening. I'm Joshua Rosen, and this is an evaluation of PTSD and its impact on veterans aged 22 to 45 for Kaiser University's Psychology Department. Post-traumatic stress disorder, or PTSD, remains one of the most pervasive and disabling mental health conditions affecting military veterans today. This is especially true in the case of veterans aged 22 to 45, as this population has been shaped by the aftermath of 9/11 and the conflicts that have spread forth afterwards. These post-9/11 veterans are uniquely vulnerable due to both the intensity of their service and the challenges of transitioning to civilian life afterwards. These veterans are at high risk of PTSD and depression symptoms, with studies showing that veterans who deploy and experience combat trauma are at particularly high risk. Analyzing the relationship between combat trauma and symptom severity, the challenges of reintegration into civilian life, as well as the individual and systemic barriers to effective treatment, we can not only understand the challenges that these veterans face on a day-to-day basis, but help eliminate the underlying causes of PTSD from the source. PTSD is a mental health condition classified as a trauma and/or stressor-related disorder, and it's defined by the development of persistent psychological symptoms following direct or indirect exposure to an actual or threatened death, serious injury, or sexual or emotional violence. It's typically characterized by disruptions in mood, behavior, and the functioning that impairs our social relationships, occupational performance, and daily life. This disorder affects every part of a veteran's life. After facing the stressors that the veterans can experience, symptoms of PTSD may emerge, including intrusive re-experiencing, which includes distressing memories, nightmares, or flashbacks; avoidance, which is a conscious effort to avoid thoughts, feelings, or reminders of the event; negative alterations in cognition or mood, persistent negative beliefs about oneself, or emotional numbing, feeling of detachment from friends, family. What can also happen is arousal and reactivity changes. This is hypervigilance, exaggerated startle response, irritability, or aggression. This supports a diagnosis of PTSD based on the definition outlined by the DSM-5. These symptoms often co-occur with dangerous behaviors such as substance abuse or misuse, risky driving, aggression, which can exacerbate functional impairment and increase health risks. These are often the first signs that a veteran needs help and is experiencing a problem with PTSD, even if they won't admit it for themselves. Each of these areas impact PTSD symptom severity in different ways. Many veterans, specifically those aged 22 to 45, can experience two or even all three of these factors. This disorder affects military veterans and post-9/11 veterans more easily. As we can see in the figure, 87% of these veterans report exposure to at least one severe trauma event during their tour of duty. Many in this age group are still in transition from the military to civilian life, a period that can compound stress and make it more difficult to manage trauma-related symptoms. This group of veterans has been shaped by the terrorist attacks on 9/11 and have seen combat of varying intensities and lengths for a very long period of time. For many of them, they're also transitioning out of the military and adding that stress onto prior combat stress, and it could feel overwhelming. A systematic review of studies conducted between 2011 and 2022 found that military combat exposure, or MCE, is independently linked to an increased risk of developing PTSD among U.S. veterans. These findings highlight the substantial psychological impact of combat-related trauma reinforcing the connection between direct exposure to military combat and the intensity of PTSD manifestations in veterans. While genetic effects can make a person predisposed to PTSD symptoms, the environment factor is overwhelmingly shown to be a more powerful and better predictor of PTSD in veterans, specifically those in the post 9/11 era. Veterans with higher levels of combat trauma are particularly vulnerable, as their risk for developing PTSD is shaped by the interaction of inherited traits and their life experiences. A meta-analysis done by Sundin et al. Out of Cambridge found that when compared to Vietnam veterans, veterans of the war in Iraq were found to have double the rate of PTSD symptoms. 14.7% of Vietnam veterans experienced PTSD after their combat exposure, where 30.9% of veterans of the Iraq War were diagnosed with PTSD. This analysis also found that these numbers increased over time for Vietnam veterans, suggesting that the policymakers and the current treatment plans and methods in place for veterans may not be effective for these veterans or veterans of the future. Repeated combat exposure also increases the risk of moral injuries. That is a psychological distress that stems from violating one's own moral ethic code. Examples of this kind of injury would include killing another person in combat, taking their lives, failing to prevent the death of a teammate. While moral injuries don't always fit the diagnostic criteria for PTSD, according to the DSM-5, it may cause intensification of symptoms or prevent recovery for veterans. Moral injuries often leave lasting psychological wounds that conventional treatments may not fully address. The transition from military to civilian life introduces a critical window for intervention. Yet this is also a period where many veterans encounter significant disorientation, social alienation, and loss of identity. When veterans feel their concerns are not being met, or they feel forgotten after transitioning from the military, real societal costs can be seen. We have issues of veteran homelessness, prison overcrowding, substance abuse, and suicide are all consequences of veterans transitioning home with PTSD and not receiving treatment and support that they need when they need it. It's often during this reintegration into civilian society that the long-term effects of trauma fully emerge. Veterans in our age group of 22 to 45 face a unique intersection of developmental, social, and occupational pressures during this stage of their life. All of these new challenges can lead to transition stress that can build upon the already existent PTSD or be a trigger for PTSD. Transitioning from the military service to civilian life presents significant challenges for post 9/11 combat veterans. This includes difficulties in employment, changing family roles, social relationships, and their personal identity. Studies show that nearly half of veterans report trouble readjusting, with many experiencing worsening mental health symptoms, including PTSD, anxiety, and depression, and unfortunately, substance abuse over time. This transition period can often feel like a reset of a veteran's life, their personality, their identity. Everything changes, restarts from when they joined the military to when they separated. Despite the high rates of PTSD, depression, and alcohol misuse among soldiers returning from combat, only a small percentage of veterans seek or receive mental health care. As we can see on our slide, approximately 29% of veterans go in search of mental health care during their service and afterwards, while 82% of them acknowledge that there's an issue. This discrepancy in veterans acknowledging the problem and seeking a treatment for the problem is only one issue on veterans' minds. There are 4 primary reported barriers, as a 2018 study found. Those are logistical issues, emotional readiness, the stigma to treatment, and a concern for treatment methods. Of the 4 reported barriers, logistical issues was the least reported, with approximately 8% of veterans reporting issues with time to go seek mental health assistance or distance from a support facility. A larger subsection of veterans believe that they're not emotionally ready for treatment, with 22% of them being worried that speaking about their experiences would trigger an outburst or negative thoughts and emotions. Treatment methods are reported as a concern of 40% of veterans. These treatment methods are worries about prescription medication and if doctors really understand who they are. These barriers do overlap, but the statistics provided represent the veteran's primary concern. Stigma is a larger issue. Stigma is defined as a negative label given to a person based on a characteristic that goes against a societal norm. Despite increased awareness about PTSD, many service members and veterans still associate help seeking with weakness, failure, or career consequences. These beliefs are beliefs that are ingrained during service and are reinforced by military culture. Normalizing mental health treatment within the military and veteran communities should begin early, during service, and continue through the transition and reintegration periods. This could include embedding mental health education into routine training, leadership modeling healthy behaviors, and promoting anonymity or confidential care options for those that need it. Cognitive behavioral therapy, or CBT, is a widely recognized in clinical psychology as an evidence-based first-line treatment for PTSD. This approach emphasizes the connection between thoughts, emotions, and beliefs, as well as an individual's behaviors. These treatments need to be supported by other methods like exposure therapy, pharmacological aids, and alternative methods. While CBT is a traditional approach, it might not work for everyone by itself. To provide individualized care to veterans who have been taught by experience that traditional care is not acceptable, adding in an alternative method might be more effective. Especially when including techniques like exposure therapy, CBT can be a highly consistent and effective intervention method. Studies using exposure-based CBT saw significant reduction in PTSD symptoms and avoidant behavior. Meta-reviews have been done on the correlation between traditional mental health techniques combined with the medication and found that they help support a positive outcome to treatment. When combined with therapies like CBT, a holistic approach currently being used today is a program called Back on Track. This treatment approach integrates a conventional psychotherapy with pharmacological approaches. And this approach, being a holistic method, addresses the mind, body, the social, and the spiritual needs of the patient, providing a treatment method that treats the whole person rather than just the symptoms. This program demonstrates a practical, low-risk alternative to traditional PTSD treatments. Alternative intervention programs have begun in VA facilities as well. They assist veterans in reliving their traumatic events with exposure therapy. Virtual reality graded exposure therapy, or VR-GET, is a therapeutic intervention that combines immersive virtual reality environments with traditional exposure therapy techniques. This treats PTSD by allowing veterans to gradually confront traumatic memories in a controlled, realistic setting that simulates a combat experience. During these sessions, it's important to note that veterans are guided by a doctor through customized scenarios while their vital signs are monitored in real time. And the real-time monitoring of their vitals allows physicians to see the whole picture and treat the veteran in a more holistic method. They can see what specific scenarios are affecting what parts of the veteran. The National Library of Medicine conducted research on this therapy and found significant reductions in PTSD symptoms, anxiety, and depression among participants following the VR-GET treatment. Despite the availability of thousands of programs designed to aid veterans, many are underutilized due to logistical challenges, confusion about eligibility, or the stigmatization of mental health care. Failure to address these concerns is the primary reason that many veterans do not trust the VA with their primary or mental health requirements. While the Department of Veterans Affairs plays a central role in providing care, studies have shown that significant percentages of veterans rely on non-VA or community-based providers. This trend highlights the need for a broader coordination between the VA and external organizations to ensure that veterans can access the care that they need regardless of where they are and how they'd like to seek it. To effectively address the growing impact of PTSD among veterans, especially in our age group of 22 to 45, a multifaceted strategy is necessary. This includes efforts to reduce the stigma, expand access to care, enhance traditional programs or transition programs, and promote further research on PTSD and the symptoms involved. Veterans suffering from PTSD have access to a number of resources, yet many of them are underutilized due to lack of awareness, mistrust, or logistical barriers. Increasing the visibility and accessibility of these services is a critical component of any effort to improve veterans' mental health outcomes. While the VA remains a central provider to veteran mental health care, many veterans do not exclusively rely on its services. A 2018 report found that in Operation Enduring Freedom and Iraqi Freedom, veterans, 36.4% received mental health care from non-VA providers, and nearly 35% received complete medical care independent of the VA. Despite the growing attention to veteran mental health care, more research is needed to understand the long-term effects of PTSD among younger veterans. Specifically, future studies should examine the effectiveness of alternative and integrative treatments such as the holistic approaches, or VR-GET as we mentioned. Additionally, research should explore the systematic barriers within the VA healthcare system that discourage engagement and the specific needs of veterans. Veterans have options when it comes to receiving mental health care today that older generations just didn't. Telehealth and virtual mental health appointments have emerged as a valuable tool for expanding access to PTSD treatments. These treatment methods have been proven to be just as effective as in-person treatment and should be used for those in rural areas or those with the logistical distance issues. Addressing PTSD in veterans is a concern for us all. These veterans sacrificed their freedoms and for some their lives in an effort to keep every civilian back home safe. These veterans need our help as they struggle with the demands of military service, the systemic changes that come when they transition home. It's imperative that we push for system-level reform and not just insist on individual treatment. The whole system is the problem, and only when it changes to accommodate all veterans can we solve this issue. Only when we acknowledge the unique challenges that our veterans face can we begin to take the steps required to remove the barriers that obstruct their recovery and work together to ensure that no one is left behind. Thank you for listening.